What I'm going to talk about to start with is the thing that we're seeing encroach on the freedom of medicine, which is the dialect of deceit. And then I'm going to talk to you about what we're kind of doing about it. So about a week ago, I received a packet in the mail. It was from Blue Cross Blue Shield, and it said, reasons why you should join Blue Cross Blue Shield. Well, I haven't looked at these in a long time, so I went ahead and opened it, and when I did, it said, reasons you should join. And it talked about their guidelines and how many people were in it, but there wasn't one single thing that said what the benefits to the physician were. Not one single thing. But what it did say, as I kept going through this 15-page contract, is paragraph after paragraph of the doctor shall submit. The doctor shall submit. The doctor shall submit. Every single paragraph started out that way. And I actually have an advertising background, and that didn't seem like a very good enticement to me, that every single thing wanted me to submit. It was almost like written in this hypnotic, overwhelming chant or hymn about doctors submitting to an insurance company. There was nothing about the patients. It was just about the company and the doctor and the submission of the doctor. So much of the language I was thinking that's in this receding tides of rights and autonomy is in this whole dialect of deceit. And we doctors are victims of this. When we submit a claim for reimbursement, we do that instead of demanding payment. We do maintenance of certification that in fact uncertifies doctors unless we pay up. And as you'll hear later, this is a billion-dollar industry. I am currently doing my recertification, and it has taken over 60 hours of forms and surveys to do that have absolutely nothing to do with medicine. And for me, most of the questions on the surveys have to do with insurance, so I can't even answer them. But all of this is just an effort to keep us subservient and for someone else to take our money. To be properly paid in electronic medical records, doctors have to prove meaningful use, which implies that everything they've been doing up to now has been meaningless and useless. Doctors have to do ICD-9 codes. Every single patient has to be reduced to a number in order to treat illness. As a matter of fact, we can't even order tests unless they already have a code. So how are we supposed to know what they have before we even have the code number? And pretty soon we're going to have ICD-10 codes, which will be thousands upon thousands of more codes. I don't know if you all know how ridiculous these codes are already, but the new ICD-10 codes are even more ridiculous. There is a code for a bite from a macaw, which is different than the code from a bite from a parrot. So if you do one code versus the other, and I accidentally think it's a parrot instead of a macaw, then I'm committing fraud. There's a code for hit by turtle. I'm not kidding, okay? There's a code for a attack by dolphin and subsequent attack by dolphin. There's also a code for burn while water skiing. Okay, I went on the internet, because you can find just about everything on the internet, but you cannot find burn while water skiing. There is no such story. So a lot of these codes are just absolutely made up. They're not real things that actually even happen. And yet we're going to have to go through all these codes in order to be paid and in order to take care of patients. We do quality control instead of cost cutting. Patient privacy. On patient privacy laws, HIPAA laws are actually just the opposite. What the HIPAA laws say is that nobody can have your information except for your employer, the government. Okay, well, those are the two people I don't want to know my private information. And in Texas, they just recently passed a law where all your records when you retire have to go to the government. That's not patient privacy. We fight with insurance companies now for authorization. How many of you have gotten in the last week something back from the pharmacy that said you have to authorize it? Well, I'm pretty sure you authorized it the first time when you wrote it. And when the patients hear that, they actually think that you didn't do something. They call and say, you need to authorize something because they won't give me my medicine. When in reality, I tell them, it's not that I didn't authorize it, it's that your insurance company doesn't want to pay for it. That's the truth of the matter. I have a patient right now who just recently died of cancer. We were giving her Adderall to help her be alert so she could finish some of her affairs and talk to her friends as she was going through this process. It worked extremely well. However, we got a prior authorization for her. It's a checkbox that says, does she have ADD? Yes or no. Has she met criteria based on these forms? Yes or no. Does she have narcolepsy? Yes or no. No, no, no. I hand wrote in this little space why I wanted it, but that's not what happened. It was denied. And that's a person at their very end of the life who thinks they have insurance that's going to help them through the very worst process, and they get nothing. When we talk about freedom, freedom used to actually mean freedom. Now it means without, as in sugar-free, fat-free, guilt-free. There's no freedom. So we have to recognize these attacks by our enemies and recognize that there's this deceit and this language is everywhere around us. And the power of language to mold and direct thought is extremely dangerous and extremely powerful. As thought follows, so does speech. As speech, so does thought. So I would encourage you not to give in to this dialect of deceit. Be aware of these things that have the opposite meaning, things where we are having to submit. These strategies of our opponents to try to make us give in to these things continue. I don't know if very many of you know about the Delphi techniques, but I can assure you that these hospital boards, these insurance boards, when you're asked to be on these, they know these techniques. So these are techniques where they try to segregate you, put you with somebody who's a little crazy, get you upset, and make you look crazy. And I know some of you have been asked to build consensus on committees, and you go in, they listen to you, or you feel like they listen to you. They say they have doctors who are helping to make these committees, and then when the final product comes out, there's nothing we said in it. There's nothing at all. Don't give in to that. The TMA actually said, well, we have to side with the AMA because we need a seat at the table. That's not a seat at the table. That's a seat in the slave ship rowing. That's them asking you, which sort of whip do you want to be whipped with? You're not actually contributing. When the AMA started, it was actually a noble organization. As you could see, they were actually against Medicare, but not anymore. Now they're the handmaid to Medicare. We don't want to do that, and we don't want to give in to that. The AAPS was a big part of abolishing the Clinton health care plan. We support doctors who are falsely accused of fraud or misconduct. And I've talked to a few of you today, a few of you who would not have your practices if it weren't for the AAPS. We believe in the Hippocratic Oath and the way it was meant to be and the way that it really stands, not the newfangled Hippocratic Oath, the actual way it was. Even as we speak, we're halting the abuses by the Texas Medical Board. Right now, it gives me great pleasure to think of those medical board people up on the stand in front of Andrew Shafley, the exact same position that they put doctors in. My husband went there just to see that, and he said it was a wonderful thing to see. So, we will continue to fight to stop Obamacare and the enslavement of physicians. We'll fight any government encroachment that threatens the practice of medicine and the rights of our patients and doctors. And this organization is an organization you can be proud of. This is one that everyone here today should get another doctor to be in it with you, because this is the real thing. We stand up and speak for doctors. When you're here, you actually have a voice. And I would ask you, I would beg you to get other doctors to come in so they can have the voice too, so they can be part of this noble organization. As Benjamin Franklin said, if we do not hang together, we will surely hang separately. And that is absolutely true. I invite you to have the freedom to stay in this organization with real working doctors like yourself and stand up for our rights together. And I can tell you that this doctor and this organization will never submit. Thank you.